Joining us now from the Wellness Company is Dr. Peter McCullough. It's good to have you, Doctor. This transition from Biden to President Trump is underway, and some of the president's picks have delighted his base and sent chills down the spine of the D.C. establishment. Before we talk about specific picks, I want to ask you in general if you believe it's a good thing President Trump is bringing in so many outsiders. I know there's a debate right now in our chat on Elon, but these people are ready to slash and burn government because they don't have loyalty there. And many of them, I think, however optimistic or idealistic they might be, folks like Kennedy especially, ready to just make big sweeping changes. Your thoughts?
America's ready for change. I think there's no doubt about it. Many of us have been frustrated with fiscal irresponsibility of multiple administrations now over the decades. So Elon Musk and Vivek Ramaswamy, bringing in financial accountability, cutting costs. Robert F. Kennedy expected to really make sweeping changes in healthcare.
Yeah, it really is looking exciting. But because they're new guys, Doctor, they might make some mistakes that don't fit well into the way we're used to seeing government done. You don't sound very concerned about that.
Well, remember, the agencies are so large. They run from the middle layers. The people at the top provide visionary direction. They're so huge that they are going to be functioning at a very high executive level. But I think we can see some specifics in healthcare and biopharmaceuticals. And I think one of the things that will come up will be getting rid of direct-to-consumer advertising of pharmaceuticals on mainstream media and social media. It's not done elsewhere in the world outside of New Zealand. And, Americans pay for the costs of all this advertising packed into the expensive new branded drugs that come out.
Yeah, I hope you are so right about that. I can't wait. I hope day one there's an EO that starts the ball rolling that says no more. Just no more. There's no reason why Americans should fall victim to a corrupt pharmaceutical industry that advertises, and you can't even tell what the ads are for half the time. They're just these touchy-feely, happy. You're like, what did I just see? And what, do I have that condition? You don't even know. You don't even know. It's crazy, and it really shouldn't be this way. But also, there's very little burden of efficacy anymore in suggested drugs for doctors and especially psychologists, psychiatrists to use and recommend for patients. The list goes on. And people are dying from this. You can't just drug your body to death. Between all the vaccinations that are recommended and all the medications that are recommended on the tail end, but there's so little talk, Dr. McCullough, except for at the Wellness Company and in some other medical enclaves, so little talk about prevention. Are we going to finally see some talk about prevention?
I think Robert F. Kennedy and Donald Trump will bring a team of new doctors. Remember, doctors take key positions in Washington in healthcare. Assistant Secretary of HHS, U.S. Surgeon General, the heads of the divisions of the National Institutes of Health, head of the CDC and its respective divisions. So a lot of new doctors with a focus on prevention. And not getting to this massive use of pharmaceuticals. And I do believe Robert F. Kennedy will achieve his goal of making America healthy again, actually our collective goal. But these key physician appointments, many are waiting to see, how they will settle out. At the Wellness Company, we do focus on non-pharmaceutical solutions first, and then handling so much so patients don't have to spend all this time with the doctor and with prescription drugs.
I mean, the ultimate goal is a healthier America with fewer chemicals in their body that could be in any way detrimental, right? I mean, that's the ultimate goal. I know that's been the goal of the Wellness Company forever, since its inception. But Dr. McCullough, you being a physician, I want to ask you, there's concern talk out there, especially in regime media, that RFK, he's not a physician. He's not a medical doctor. And some of the people he's surrounding himself with are physicians. Some aren't. Do you have any problem with that? You don't sound too concerned about that.
His predecessor, Javier Becerra, he's a lawyer, so it's common for HHS secretary, cabinet position, to be a lawyer. And Kennedy will rely on the clinical and medical expertise of the physicians that are assigned. They work as a team.
And physicians, hopefully, Dr. McCullough, who are ethically bound, not bound to Rockefeller medicine, not bound to big pharma money, big hospital money, the money of the AMA, et cetera, et cetera. So we're really hoping for a new day here. It feels like the sun is shining a little brighter, doesn't it?
I agree.
Dr. Peter McCullough, thanks so much to you and everyone over at the Wellness Company.